I'm Lee Doherty Biddison.
And I'm Carolyn Kamsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us. Hello, and welcome back to our Vital Conversations podcast. I'm Carolyn Kamsty Fowler, and I am delighted today to introduce you to a colleague and friend of mine, Dr. Cassie O'Malley. Cassie is the Senior Director of Wellbeing and Innovation at MedStar Health. In this role, she is responsible for wellbeing programming and integration of over 15,000 nurses, physicians, and advanced practice providers. She focuses on the intersection of mindful work, such as breath work and sound, with innovating the care delivery system to better support clinicians in thriving at work. Cassie is also a coach, educator, and mom of 3 beautiful girls. Welcome, Cassie.
Hi, Carolyn. Thank you so much for having me.
Oh, well, I am delighted. And before we get into some deeper questions about practice, I'd just like to invite you to introduce yourself because you've been a nurse leader and advocate in the wellbeing space for several years. So perhaps you could share how you came to this work and why it's so important to you.
Yeah, sure. Thank you. So I had been a nurse for about 15 years-ish now. I started in oncology, and I think that when I reflect on my work now is absolutely the foundation of how I came to be where I am. I would spend all this time with patients, in oncology, oftentimes your patients are your patients for many years. So you get to know them, you get to know them well, you get to know their stories. And what I felt I loved so much in my work was helping my peers be able to care for their patients better, right? So I loved being a charge nurse because I felt like I could set up the day to be really great for my team so that all of the patients on the unit would have a experience where they felt held and supported rather than their nurses having to frantically run in and out of their room. And that kind of was my catalyst as I then advanced in leadership to think about how I can create the best environment for my teams so that then the patients get the best experience. And, I took that into outpatient management and then later into all of clinical practice and education. And each time I took on a larger role, I was thinking about how could I just make the environment better for people. And I've always been into my own mindfulness, well-being work personally. I liked to bring that to people, but I kept seeing that I could bring that to people as much as possible, but if we didn't make the place that they worked better, it didn't matter. And so that's kinda how I finally landed in this well-being role at MedStar Health where, I get to do both, right? I get to coach people and give them breath work and sound healing, and I get to help look at the care delivery system so that once people are well, or if they are well, or if they're working towards their well-being, when they come to work, it supports that, it doesn't degrade it.
I love that you're telling this story because, we've got this really long-standing enculturated belief in nursing that that we have to sacrifice ourselves on behalf of our patients. And yet the story you're telling is that really if we take care of our colleagues and we take care of the practice environment, then that helps us take better care of our patients and their families.
Completely. I mean, I think our patients know like, they know whether we are having a good day or a bad day. And so, they're humans, they see what's happening, and so I think it's our responsibility as leaders of healthcare organizations to create environments that make it an optimal place to work, right? So that the patient doesn't have to experience the stress of the clinicians because the work environment isn't set up for their success.
Right. Yeah, and I know that you and I have had conversations about this, that, while it's necessary and important to provide support for individual physical and mental health, and you definitely
Mhm.
do that,
Mhm.
um, we advocate that the real work of transforming organizational well-being lies at that intersection of practice delivery or the practice environment and then the healthcare system optimization. Could could you walk our listeners through your thinking about that?
Yeah, I mean, I think that is that's the most critical part of this well-being work that I think is it's kind of phase 2, right? Phase 1 very much, I think, illuminated during the pandemic, where we recognized that clinicians were working in, you know, deep, difficult work, and so we had to focus on their mental health, their physical health, like, supporting that. And then we got to this space where and I think what we're in now is that, yes, all of those programs should be foundational, but the true well-being work is, as I've said, kind of creating an environment that, then supports them when they are, um, taking care of their health or we're supporting them taking care of their health. So, I think about things like, for example, for, virtual nursing. Across nursing, we've just started to scratch the surface with that, right? Like we took it from a task-based perspective. So you saw a lot of work with admissions and discharges. But if you think about the technology and innovation that we have in this world right now, there is so much potential to integrate something like virtual nursing in a way that A, takes some of the burden off of the teams on the units and like in the patient's room,
Mhm.
but then also offers nursing a different role. Like, it's hard to be in the hospital, right? It's hard to be at the bedside. And so, if you can imagine having this option where maybe one day I'm not at the bedside, but I still get to practice my expertise in a different way. I get to connect with patients in a different way because it's uninterrupted, right? Like, think about how many times as a nurse you go in to talk with a patient, or you go in to do something to talk with a patient, and you get interrupted because something more pressing is in the next room. Well, in virtual nursing, you can be with that patient. You can really spend more time connecting too without interruption. Doesn't change the unique and deep need for that in-person physical connection, but it gives, a different type of experience for nurses that also allows them to expand their skills and get a little bit of the physical break, you know?
Yeah, I mean, that combination of being able to really engage in deeply meaningful and connected relationship with patients, and that ability to just honor what you need physically, I think is
Mhm,
very appealing. And, I was talking to a group of nurses just about 3 weeks ago, and a couple of them shared that they'd had injuries at work,
mhm,
which weren't that severe, but actually kept them out of physical
mhm,
in-person nursing. And each one of them shared, I could have been providing care virtually with this fairly
mhm,
minor injury, but I wasn't allowed to be in a clinical setting with it. And I thought
mhm,
about what a missed opportunity to have highly motivated and highly skilled clinicians be able to stay in the care space
mhm.
despite that.
Yeah, I think the other thing too, Carolyn, and you might have to fact check me on this stat because it's either 1% or 10%, but there was, a study that came out around, like, the amount of information that is used in the electronic health record, and it was
Mhm,
staggering, right? Like, it's either I really wanna say it's 1%, but we may have to fact check that. But
mhm.
only 1% of the information in the medical record is used by clinicians in a 12-hour shift.
Right.
So, I mean, when you think about that and think about optimizing the workplace, we've put things into place that are meant to help. Is digitalizing the medical record a positive? Absolutely. Right? It helps us connect care in a different way. However, a lot of times we put things into place without thinking about all the implications that then may cascade or ripple out after it. So I think that one too, like we've put barriers in some of our optimizations that we now have to go back and really think about what do we need as a necessity to um and what can we kind of strip away to make the workplace um more accessible,
Yeah, well, how do we make work easier? I mean,
Right.
how do we, yeah, and we've actually done a couple of podcasts, Cassie, on cognitive load and the
Mhm.
and how streamlining our systems and streamlining our processes and getting rid of the redundancies can actually reduce the cognitive burden that we're facing every day.
Mhm. Definitely.
So I noticed that you actually haven't used the word nursing well-being terribly much after our first couple of conversations.
Mhm.
And I know that another commitment that we both share as nurse leaders is that we have to focus on interprofessional or total team well-being as opposed to just nursing well-being.
Mhm. Yeah, when I started my current role, I actually started in nurse well-being, and we've expanded so that my role looks at all of clinicians because what we realized was, yes, there are some unique needs that each of the clinical roles has within the healthcare environment. And if we focus on them separately, we're never going to achieve complete well-being of our healthcare teams because the reality is all of our work intersects. And not just from a how we care for the patients, but we are with each of the other clinicians all day within our teams, right? And so if we're doing these things in separation, then ultimately we're missing this piece of how does the team come together to make sure that the team as an entire unit is well together, right? And so uh, this, I think, sometimes I think is controversial. I think people very much still believe that nurses have such specific needs that their program needs to be individual. Physicians, you needs are so unique that they need to be individual. Same with APPs. But the reality is, when it comes down to what people struggle with from a well-being perspective, they're all human things, right? It's
Hmm.
not just because you're a nurse or a physician, it's because you're a human, right? A lot of what I talk about is people when they have well-being needs comes down to one of 3 things: connection to self, connection to others, or connection to purpose, right? Those
Yeah,
aren't
absolutely.
specific, right? Those aren't specific to the role, they're specific to a human. So I think that's our goal is really to get people to think a little bit differently and recognize the importance of the whole team working together to be well.
Hmm. I had a sense before the pandemic that we were doing a little better in really moving more strongly into this total team space.
Mhm.
And yet during the pandemic, certainly I became aware of increasing isolation and increasing separation between the professional groups.
Mhm.
And I don't know to what extent it was that sort of self-preservation that comes with burnout or with stress that let me put up the barriers so I can keep myself safe.
Mhm.
What's your sense of whether that you saw that happening during the pandemic?
Yeah, I mean, I think you're right. I I think we were getting better. You saw a lot of like development programs and content before that were focused on interprofessional work. And then I think early in the pandemic, right, people did, they all teams came together because
Hmm.
it was in that crisis mode where you had no choice but to work together. And then the longer it went on, the more tired and exhausted. And to your point, self-preservation, people got, the world around us was saying, like, stay to yourself, don't be with other people, right? Especially with healthcare, because you're exposed to everything. And so I think, um, I think the other thing is that with that, healthcare has gotten progressively more difficult. And so without purposeful work and support to bring teams together, naturally they start to diverge
Mhm.
because they're trying to preserve themselves. And so I think that's where we are in this. We have to bring it back together, you know?
Right. Well, I think I shared with you that I've had a couple of conversations which troubled me
Mhm.
with nurse leaders outside of our two organizations,
Mhm.
um, with where it was really a sort of a real commitment to sort of keeping it in nursing.
Mhm.
So what would you say to nurse leaders who believe that they are protecting nurse well-being efforts by continuing to focus only on nurses?
Yeah, I mean, I think when we've talked about this before, um, there was this sentiment that maybe they feel like it's to keep them safe. And I think ultimately it's the opposite, right? I think that if we go in this direction of just focusing in on ourselves, we are going to just isolate more. We're going to create, uh, a bigger barrier or sever in um, our relationships with the other clinicians that, and not just clinicians, but all people that support the healthcare delivery system.
Mhm,
That the reality is, again, you are all working together for the patient. And so the more you isolate, the more the challenges are going to grow, because while the nurses are so often, and I think I believe strongly, or as the words you have used beautifully, are the connective tissue of an organization. And, you know, biased as a nurse, I do fully believe that hospitals and patient care don't run without nursing, right? And all of those other roles do support the patient care. And so if we pull away, if we isolate, if we make ourselves just by ourselves well, then we are creating that separation that ultimately is, I think, going to become a bigger challenge for nursing.
mm. Yeah, I think that when you and I, well, certainly, I mean, I've been in nursing a lot longer than you, but I think when you and I first started our careers, it was a different world. We were part of teams where people stayed in those teams for years.
Mhm.
In those teams, we had more experienced nurses than we had inexperienced nurses, and now that has
Mhm.
completely flipped. And I feel really concerned as a nursing well-being leader. I feel really concerned by the level of anxiety and perhaps self-doubt I observe in many of our new graduates and new clinicians.
Mhm.
And, I worry that they're almost have a perception which is like, I just have to survive this. I just have
Mhm.
to survive this and tough it out until I get better clinically. And yet, well-being's not about survival. It's about flourishing. And it's about flourishing so that you can flourish, as a clinician, as a colleague, as a human being, as a team member.
But don't you think that's how we, like, invite them into nursing? Like, we invite them in and say, "Oh, this first year is so hard." Just from the moment they're in school to the moment they hit our doors, like, that's how we frame it, right? That it's gonna be so difficult. And you have to tough it out. And, you know, I mean, I love nursing. And again, historically, nursing has been really tough on its newbies. And I think it still is because, to your point, the way that people are going to practice in healthcare now is different, right? Like,
Mhm.
people aren't going to stay on the same unit for 15 years. They're not going to do that. And that gives us this beautiful opportunity to say, okay, people want to keep, growing and shifting and innovating and thinking about how to do things differently. So let's use that rather than saying, oh, you're not putting in your time. Shame on you.
Right.
Mhm. I
Right.
mean, I had that experience as a young leader. And this was, well, 15 years ago, but I made a decision after, gosh, I must have been on the floor for about 3.5. I was pushing 4 years. So still not, I mean, that wasn't that many, right? And there was an opening in our organization for an outpatient oncology manager. And I remember my like first mentor, who I love deeply, but she'd been on the floor for 30 years. And so she was not happy with me. Like, it hurt her, right? It hurt her that I wanted to make that move because she saw a lot in me. She saw like I was good with our patient care. Like, I loved oncology nursing and being at the bedside. And again, as I said earlier, like I saw beyond what I wanted to do. And I mean, I'm grateful to have had other people that would have supported that. But I think about that now. People come into this really difficult healthcare environment, and then if that's what they're met with, I don't know. They might just stop.
Yeah, I mean, I think this whole idea of paying your dues, you have to have so many years at the bedside before you can be a leader, or if you choose not to leave the bedside and step into leadership, that's wrong too. I mean, I think
Mhm.
that the creating a space where we honor each person's unique journey in nursing and leadership to be able to give their gifts, I think is important.
Mhm.
Uh, I really worry about the pay your dues concept because I think it's okay for us to say this year is going to be hard. It is going to be
Mhm.
hard because there's something about the mental rehearsal to know that, yeah, it's going to be tough. There are going to
Mhm.
be challenges.
Yeah.
And yet, I think it's also our responsibility to say, yes, because it's going to be tough and because you're on a steep learning curve, we are going to equip you with some support and some skills
Mhm.
to keep yourself in better balance, whether it's
Mhm.
breath work and the sound healing you do, whether it's some of the community resiliency work that I do. All of these things are things which are able to say it's it's quote unquote normal to feel stressed right
Mhm.
now. What it's not normal to be is isolated and afraid that you're failing because you're feeling
Mhm.
like this.
Yep, and staying in that heightened stress response, like, that's what we see so much, right? Like, people sit in this fight or flight, and we know this, a little bit of stress is good for you, right? Like, that's
Hmm.
normal, to your point, like, we need that normal ebb and flow, but what we're finding is that people just live in it, right? Like, we use and I think you guys use something similar, but we use the stress first aid model,
Yes. Hmm.
and we find so often people just sit in that orange, like, just before crisis section, and, yeah, I mean, I think we need to help people build the skills to bring themselves out of that.
Hmm. Well, and I also think that, so often when I talk to nurses, they want to support the well-being efforts, and yet they'll say we're so busy doing the work of nursing
Mhm,
and with our staffing issues and all of those things, we just don't have the time for it.
mhm,
And yet, as I think about what you just said, um, that living in the edge, that living in the yellow-orange space of
mhm,
stress,
mhm,
um, I mean, firstly, it's not good for us.
Yeah.
It's not good for our relationships. It's not good for our personal lives, but it's not good for our clinical reasoning and our clinical decision making.
No. No. And I think I do a lot of work with nurse leaders, and eh, it's so interesting because I think both within my organization, but also more broadly with the consortium and stuff, what we hear from people is that the nurse leaders are increasingly more stressed because they are increasingly more consumed both by the difficult nature of the healthcare environment right now, but also that their schedules are booked constantly, right? So nurse leaders
Mhm.
need to be out with their teams, and and organizations say they understand that value and they understand well-being, and yet nurse leaders are booked from 8 to 5 in back-to-back meetings.
They're lucky if it's only 8 to 5.
Well, right, right. It's oftentimes more, to your point, because the 8 to 5 is already booked. And so the only way then that they can be with their patients and their teams is if they come in at like 6 or earlier, and then they stay till 6 or 7. And by the way, these people have families.
Mm-hmm.
And so I think that is that's something that I actually think is critical at this moment, is looking at how do we make it okay for nurse leaders to actually be with the people that we need them to be with.
Right.
When I coach a lot of our nurse leaders, and constantly I hear about, oh, we get these urgent meetings, or somebody will put a meeting in a place that I have blocked and just expect that I'm there. Or
Mhm.
if I'm a med surge leader and I have 3 other peers that are also leaders in my division, all of us have to go to every meeting versus, splitting it and then coming together and sharing it. And I
Right.
think that's something that I feel like we speak about, but in practice, we don't actually help people implement.
Right. I mean, I think that's one huge piece of it. And I think the other piece of it for our colleagues who are nurse leaders who actually do prioritize spending time with their people,
Mhm.
what I've also heard from them is a sense of stress associated with all that they have to listen to because they care for their people. And
Mhm.
they're also aware that their people are suffering. And so I've had so many people say to me, because I also coach them as do you,
Mhm.
I just feel like it's so hard for me to be enough because I'm running from meeting to meeting and then I'm sitting trying to really be fully present and listen to somebody who needs me to listen to them.
Mhm.
And I sort of feel like I have a double whammy here because firstly, I feel like I'm not listening well enough or I'm not able to be what they need on the one hand.
Mhm.
And on the other hand, I'm kind of recognizing the fact that this is also stressing me because it's reminding me of two things. Firstly, that somebody else needs my attention somewhere else, and
Mhm.
also that I'm not able to do more of this that I know is important.
Mhm.
And it feels like this constant sort of tug of war where they're being pulled between these different responsibilities.
Mhm.
And I've had nurse leaders say to me, and they're very self-aware, and I just so appreciate their self-awareness when they say something like, I know that when I'm in this position, I'm not showing up as my best self. Like
Mhm.
I'm not able to be fully present as a leader in the way that I need to be present.
Mhm.
And that then is distressing for them again. It's it's
Sure.
it's it's a it's a it's a challenging spiral we're in here.
Yeah, well, I mean, that's the go back to the connection to self, others, purpose. They feel like they can't, like, fulfill their actual purpose in their, like, work service life, right? Like, there's a lot of research on self-actualization, right? Like, that's what
Mhm.
that's what brings us to thriving. That's a foundation of positive psychology, is this concept of being able to self-actualize into who and what we're meant to be.
Mhm.
And so, for me as a leader, if if I were to hear that, right, which we hear all the time, but for if one of my mm, like direct reports were to say that to me, that's a hard stop. Okay, what do you need?
Mm,
Because I guarantee you we can comb through your calendar and find all sorts of stuff that you could either A, delegate, maybe, although what we often hear is I don't want to put burden on my teams, right? We often think that if we give the meeting or something to someone else, we're creating burden, which isn't always true. Or B, again, ask like a peer, if you're going to this, can you give me the cliff notes? And I'll take this next one so you can take off.
mhm.
But I think that people don't think they have permission to do that. And um, I think as in different layers of leadership, I don't think we do a great job of creating the environment where people feel like they can say no. So like in the example of, let's say I'm with one of my team members and they're really struggling and I need to be present with them, but I have a meeting in 5 minutes that I feel like I have to get to. I think most people's response is to say, and maybe not most people, but I think there's a population of leaders out there who will say, you know, I really appreciate you telling me this. Can we continue this conversation at whatever time? Versus like texting whoever is leading that next meeting and saying, listen, I really have to be with my team right now
Mhm.
because of the fear.
Yeah. Yeah.
So that's what I kind of advocate for people. I'm like, what happens if you don't go to that?
Yeah.
You know, and they come back to you and you're able to say, Cassie was really struggling, or not even Cassie. You could just say one of my team members was struggling. And as a leader who believes in creating a workplace where people feel supported and like they can thrive, I couldn't leave this person in that moment.
Right. Well, and then ultimately that's all about that deep connection, right? That is the biggest supporter of resiliency, knowing that when you are stressed, somebody will sit with you or be with you. It's
Mhm.
that the stress first aid, right? The check in and coordinate,
Yeah,
just be present. Yeah. Yeah.
absolutely.
Cassie, you had mentioned consortium, and I know we haven't actually mentioned this. Do you want to say something quickly about the Nurse Wellbeing Consortium?
Yeah, so that started, I guess it's about 3 years now.
Mm,
We have about 25 organizations from across the country. They're all nurse leaders in some level of well-being, and we meet quarterly. We're starting to really trying to get our footing under us now to put some structure in there to start doing more cross collaboration amongst our organizations, but it's just been a really incredible place to meet colleagues across the country doing incredible work and to learn from them and to try implementing things that other people are doing. I know a lot of, there's a few good examples within our group where people have heard of something in the consortium and then taken it back to their own organization. So still relatively new, but I think I see a lot of potential um, with the incredible people in it.
So, Cassie, if somebody is in nursing outside of our two organizations and it would be interested in joining the consortium, how should they go about that?
Yeah, they can email me. I think if you can link my email, Carolyn, I'm happy to talk with anybody who has questions about it or is interested.
Okay, well, we'll do that. We'll link that in the podcast notes.
Great.
And so if anybody's interested, we can follow up. And of course, anybody within Johns Hopkins Health System, if you want to know how to do it, just reach out to me and I'll connect you. So,
Yeah, thank you.
okay, let's get back to you for a moment, Cassie.
Mm-mm.
So, as someone who's balancing a leadership role and coaching and educating with parenting,
Mhm.
how do you take care of your well being?
Oh, it's been an evolution. I think the first thing that I really had to work on in myself was s- first acknowledging what I need. I'm one of those, like many other nurses, who tends to just hold on, hold on, hold on until my body says, "Hello, you haven't been listening," and then I get ill for a while. And so the first thing was really just checking in with myself, and being aware. And then I started being really intentional about speaking what I need, and B, setting boundaries. So
Mm.
um, I am really intentional at work with setting boundaries and um, recognizing my bandwidth and being comfortable in saying no or not right now. Right? No doesn't always mean no, always. It might mean not right now. And I'm also really intentional communicating at home with what I need. So I need exercise and I need uh, my like morning breath work and meditation practice. That means I get up early, but it also means that my husband and I split our time so that we can both exercise because we know that if we don't, like, we're angry monsters. So I think, it takes a lot of self-awareness and it takes a lot of communication, but once I've figured those things out for myself, they're kinda non-negotiables because everybody's happier when mom's happy, you know?
Mhm.
So I think the work thing has been, that's been a big deal for me in um, you know, being confident in saying no. I think that's a lot of where younger Cassie and probably younger leaders are like, "Well, I can't say no to that." And I feel when I choose to say no to something, I feel confident in why I'm doing it, and I feel confident in my own contributions that while somebody may be disappointed, they're not, um, judging me for who I am or my capacity as a leader because I've said no.
Mhm. Well, that's a practice that takes intention and time, doesn't it?
It does, but I think it's been the most important one for me, because I think I spent a lot of time in my own growth, like, fearing what other people might think about, um, me as a leader, and ultimately and I believe this in leading my own team, that if my team sees me do that, they're more likely to do that for themselves,
Mhm.
and they're more likely to not feel guilty if they have to do. I'll give you an example. We had a big conference that you know about, and one of my team members, she had some big thing for her son, and she, like, had, like, this kind of discord in her because it was the same day as the conference, and the conference is, like, our big thing, and for me, it wasn't even a question. It was like, "Of course, go with your son. Don't come here." Like,
Mhm.
I know you might want to, but, like, you really would prefer to be with your son. That is the right choice, but as leaders, we need to show people that so that they don't have fear around it.
Yeah, yeah. Well, as we get to the end of our time, I'm gonna offer you perhaps the last word. So is there anything else that you'd like to share with our listeners before we wrap up?
I don't know, Carolyn, you've had so many wonderful questions. I think that we live in a world of constant consumption and filling all of our time with work, activities, a million things. And I think that we might all be in a better place if we just would take a few moments to step back and give ourselves some space and a little bit of calm. Um, because I think that's where we get our own biggest insights, our own biggest connection to ourselves and to our purpose is when we're able to just sit and be present with it. So, I've kind of been offering this challenge across a couple different things I've been doing recently where just challenging people to sit for 7 minutes. It's not
Mm.
even that long, but we tend to say we don't have time, so create 7 minutes that you can just sit. You can listen to music. If you want to write, great. If you want to read, great. But just sit without like social media and email and work and whatever it might be, um, and just see how that feels.
Yeah. Well, maybe that's the challenge we'll offer to our listeners as we close out.
Yeah.
Please think about giving yourself the gift of 7 minutes to spend with yourself.
Hmm.
Cassie, it was wonderful spending time with you, and I'm so grateful to have you as a colleague and as a fellow advocate in this space. Thank you so much for sharing your wisdom with us today on the podcast.
Yeah. Thank you so much, Carolyn. It's been such a gift.
Thank you. So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.